Effective communication requires adapting messages to meet the needs of the receiver. Medical assistants interact with individuals who may have language barriers, sensory impairments, emotional challenges, or differing communication preferences. Adaptive communication involves recognizing these factors and modifying verbal and nonverbal behaviors accordingly. The method used to convey information should always be appropriate for the situation and the individual involved. Therapeutic communication is the purposeful interaction between a medical assistant and a patient or family member within a healthcare setting. Its goal is to support both the physical and emotional well-being of the patient. Effective therapeutic communication requires the ability to communicate appropriately in a variety of situations and with individuals from diverse backgrounds. Medical assistants must be aware that factors such as culture, emotions, stress, and personal experiences can influence patient behavior. Patients should never feel blamed, judged, or criticized during an interaction. Building rapport or a close relationship is a critical part of therapeutic communication and helps establish trust between the patient and the healthcare team. Active listening plays a central role in effective communication. Many individuals listen with the intention of responding rather than understanding, which can lead to missed information. Active listening requires being fully present and attentive to the speaker. The receiver's nonverbal behavior should demonstrate interest in the message being shared. Maintaining appropriate eye contact, using suitable facial expressions, and adopting an attentive posture all signal engagement. Respect for personal space is also important, particularly when interacting with patients from different cultural backgrounds. When gathering patient information, different interviewing styles may be used depending on the situation. Open-ended questions are generally preferred because they allow patients to explain their concerns in their own words and provide more detailed information. Closed-ended questions are useful when specific or limited information is required and typically result in brief responses such as yes or no. Medical assistants must understand when each type of question is most appropriate. Providing feedback is an important part of the communication process because it helps confirm that the message has been received accurately. Feedback may involve asking for clarification when information is unclear, reflecting the patient's message back to them to demonstrate understanding, or restating the information in the medical assistant's own words. Oral communication is influenced not only by what is said, but also by how it is said. Tone of voice, word choice, and delivery can affect how a message is interpreted by the receiver. Personal perceptions and experiences influence how communication is decoded. A warm and professional greeting can create a positive impression and may encourage a similar response from patients or coworkers. Patients with vision or hearing impairments should be treated with the same respect and dignity as all other patients. When communicating with individuals who have vision loss, it is helpful to explain actions clearly and encourage participation when appropriate. Patients with hearing loss may rely on lip reading or written communication, and medical assistants should position themselves so their face is visible so they may read their lips as well as speak clearly without shouting. When necessary, certified interpreters must be used. Another key note is that medical interpretation requires specialized training. Emotional barriers such as anger, sadness, or grief can interfere with communication. Medical assistants should remain calm, respectful, and professional at all times. Defensive or aggressive responses are inappropriate. When patients are experiencing emotional distress, listening more than speaking is often the most effective approach. Keeping your voice tone and pitch lower is vital for patients who respond angrily. If the situation becomes hostile, it is key to leave and immediately call someone for help. Providing time, space, and support helps maintain therapeutic communication and ensures patient dignity. Communication styles can also affect interactions. Passive, aggressive, passive-aggressive, and assertive styles are commonly recognized. Assertive communication is the most optimal approach, as it allows individuals to express themselves respectfully while acknowledging the rights of others. Understanding these styles helps medical assistants recognize potential barriers to effective communication. Aggressive communication involves attacking someone verbally. Passive communication involves not responding, as well as allowing actions to occur around them. Passive-aggressive communication is when someone gives off the impression that they are agreeing, but are really resisting. Assertive communication is expressing yourself clearly but in a respectful manner. Nonverbal communication varies widely across cultures. Behaviors such as eye contact, gestures, personal space, and touch may be interpreted differently depending on cultural norms. Medical assistants should be observant, follow the patient's lead, and use gestures cautiously to avoid causing discomfort or offense. Cultural awareness is essential to maintaining respectful and effective communication in healthcare settings. Certain communication behaviors should be avoided during therapeutic interactions. Medical assistants should not agree or disagree with patient statements, as the goal is to listen and understand rather than take a position. Offering unsolicited advice is inappropriate because providing guidance is not the purpose of therapeutic communication. Judging patient choices or experiences can damage trust and should be avoided. Responding defensively is also inappropriate, as communication should remain focused on the patient rather than the medical assistant's personal reactions. A SOAP note is a method healthcare providers use to organize and document patient information in the medical record. It is divided into 4 sections: subjective, objective, assessment, and plan. The subjective section records the patient's descriptions of their condition, including symptoms, pain level, timing, and triggers. The objective section contains measurable, observable data such as vital signs, exam findings, and lab results. Assessment lists the provider's diagnoses for that visit, and the plan outlines the actions the healthcare team will take, including tests, procedures, referrals, or prescribed treatments. Therapeutic communication is defined as an interaction between a patient and a healthcare professional that is focused on promoting patient comfort, understanding, and well-being. This type of communication relies heavily on active listening and appropriate expressions of empathy. Medical assistants should give patients their full attention and demonstrate interest in what is being communicated. Maintaining privacy, limiting distractions, introducing oneself clearly, and encouraging patients to speak freely through open-ended questions all contribute to effective therapeutic communication. Signs that an individual is not actively listening include interrupting the speaker, appearing distracted or bored, failing to follow basic courtesies, and avoiding eye contact. These behaviors can interfere with communication and may cause patients to feel ignored or misunderstood. Language differences can also present communication challenges. If a patient does not share the same language as the medical assistant, interpreter services may be required. Family members may only be used with patient permission, and certified medical interpreters must be used for complex information or consent. Communication should always be directed toward the patient, not the interpreter, while allowing adequate time for translation. Telephone communication requires special attention because visual cues are absent. Smiling while speaking on the phone can create a more pleasant tone. Medical assistants should clearly identify themselves and the facility when answering calls. Messages should be documented immediately and repeated back to the caller to confirm accuracy. Verifying the caller's name and contact information is essential in case the call is disconnected. Accurate message documentation ensures continuity of care and effective communication within the healthcare team.